One of the important aspects when it comes to understanding cancers is understanding cancer prognosis. Now, when patients are told that they have a cancer, the first thing they do is worry about what is going to happen to me. Will I die soon? This is where cancer prognosis comes into play. Prognosis helps the patient in understanding how well the cancer can be treated or how bad it can go to. Now, there are numerous factors when it comes to cancer prognosis. The first being the type of cancers. Now, different cancers behave in different ways. A cancer in the testis has a very good prognosis. After it is treated, the person leads a normal life. While cancers in the pancreas and in the lungs, usually by the time they manifest, they have already grown to a great extent, and these patients usually need a lot of therapy and a lot of treatment to ensure that the cancer doesn't progress further. The second aspect when it comes to prognosis is the staging. This is where the doctor decides if your cancer is in stage 1 or 2 or 3 or 4. Now, stage 1 cancer is a cancer where the cancer limits itself to the place where it grows. For example, a cancer in the colon, in the large intestine, remains within the large intestine in stage 1. And as it progresses to stage 2 or 3 or 4, it extends to the nearby lymph nodes, and it can go on to the lungs or the brain or the liver. We call this distant metastasis. So as the stage in cancers increase, the prognosis is bad as well. These patients usually do not do well. Now, the next aspect in cancer prognosis is the tumor markers. There are some cancers that express tumor markers. For example, in breast cancers, there are certain tumor markers like estrogen receptors and progesterone receptors. In prostatic cancers, prostate-specific antigen. So when we do a laboratory investigation, or when in the pathology lab we see that these markers are elaborated, we know that these cancers may play a different role. They may suggest a poorer prognosis, or they may be worsening. And the last aspect in prognosis is the age and the immune status of the person. The older a person is, the more difficult he is to respond to a cancer, and the poorer the immunity, again the poorer is the response. So these are all aspects that we explain to patients, cancer prognosis. So when a patient is told that you suffer from cancer, it just doesn't stop with that. We need to explain to the patients how the cancer may develop and what is the best form of treatment that we could suitably give, and for that we need to assess the prognosis. So basically, once a patient and the patient's attenders, the relatives and the doctors understand prognosis, it goes a long way in helping to make sure that the patient understands how good he or she is going to recover from cancer.